inspired to work in family planning and gender equity because I have a deep core value around fairness. Ever since I was a little kid, I would get really upset if I saw things in the world that were not fair. And I would always ask my parents or my caregiver, why is it that way? I didn't really like the excuse that life is unfair. I felt, and I've always been very motivated with my actions, that we should be able to fix the things that are unfair in the world. And as I grew up, it became really clear to me how challenging women have it, how a lot of things that happen to women are unfair, particularly what is used to justify a lot of those inequities is women's very wonderful ability to have children. I work primarily at the intersection with sexual reproductive health and rights and prevention of violence. And like most women who work in violence prevention, I also had experiences with a violent intimate partner that I was lucky enough to get out of. But it was really easy for me to see how someone with less support, a little less resources, or who was facing challenges controlling their reproductive abilities, was having pregnancies when they didn't want to, would have not been able to leave that situation. And it really has motivated me ever since to try to use all the privilege that I have had to help other women experiencing those same challenges to get out of those circumstances. I'm currently focusing in my work and my dissertation on implementation and scale up of evidence-based interventions for sexual reproductive health and rights and prevention of violence against women and children. So the last 20 years in family planning, we've seen a huge shift in the family planning methods and resources that are available for women, basically just a lot of improved access. But we still have a lot of social barriers that are preventing women from really being able to have control and agency over their reproductive decisions, which obviously has a huge impact on gender equity and empowerment. Over the last 10 years, we've also seen a real rise in evidence-based programs that seek and are effective in changing those things. Shifting the social norms that underlie patriarchal decision-making over women's family planning, improving the side effects that women see with family planning, reducing violence experiences by partner. We have a lot of solutions now that we know works, but we're at a really critical juncture in the field where we have the new challenge of trying to scale those approaches. So my work really hits on that focus. What is the science that we need to better understand how these programs can be scaled to really influence those population level outcomes for women and children? Why is it meaningful to me to contribute to family planning and gender equity? Well, I have a 2-year-old daughter, and like most moms, I would like her to grow up in a world that is more fair than the one that I did. I have a lot of hope in the direction we're heading in this field, primarily because I work with such awesome people. This is the most committed, driven, passionate group of people I've ever met, and I am quite confident that no matter what barriers we encounter, this is a group of people that will never, ever, ever quit.